in terms of incidence, because nobody really had a good understanding of what ADHD was or even dyslexia, what they did is they defined it only as severe. They took only the severest cases, the ones that were severely handicapped, and they said these were ADHD. But we all know logically that you don't only have severe diabetics that are comatose, you have mild and moderate and compensated diabetics. The same is true with ADHD. But the milder and moderate cases were not recognized, they were not understood, and they were not treated. As we now understand that there are moderate and mild cases, the apparent incidence of ADHD keeps rising. So it was once 2%, it's now considered 11%. And now many people are saying there's no such disorder. It keeps rising, it's an imaginary disorder. It's being overdiagnosed because drug companies want to sell their drugs. It's true that drug companies want to sell their drugs, but doctors make no extra money by treating patients successfully. The reason medications work for 11% of the population, as well as they work for 2%, is because they all have the same disorder. So the rise in incidence is merely a rise in understanding and a rising ability to diagnose it properly. Now, I diagnose it medically as well as symptomatically. I can now diagnose via ordinary instruments and specially designed instruments. I can diagnose the inner ear impairment even before children develop symptoms. And what I found in dyslexia and ADHD and other disorders is that you can even pre-treat the disorder once you diagnose it. You pre-treat the inner ear. You improve the inner ear, then the symptoms are either going to be less or prevented in the first place. So that we now have a better diagnosis, not just symptoms alone, but the underlying inner ear problem and cerebellar problem. And the nice part is we can screen for it early, we can diagnose it effectively, and this will tell us which treatments are going to work best. And with proper treatment, 100% of patients can be helped. Some very, very dramatically, as you can read in my many books and on my website. I have patients volunteering their names, their photos, and their content so that other people can benefit as they